Hi, my name is Bill Doyle. I am a registered nurse. I work in 2 emergency departments in Ocean County, New Jersey, and I have about 9 years experience. And my presentation is called My Infant and Fever, and this is designed to help reassure you, caregivers and parents at home, in the event that your infant does develop a fever. So my infant has a fever. What now? Is this bad? Do I need to rush to the hospital? Please just take a breather and let me try to briefly educate you, while also attempt to reassure you a little bit on how to care for your infant. So unnecessary trips to the emergency department can be from a fear of fever or a fever phobia. Fever is a symptom, not a disease. About 40% of parents with children aged 6 to 17 months can reach out to a healthcare professional, a doctor, nurse practitioner, or a nurse when their child has a high temperature. Episodes of fever are common for parents. Seeing a healthcare professional may provide reassurance and more reliable advice on self-management of that fever. This presentation is meant to reassure and provide basic but helpful advice. And my goal here is to maybe reassure you that you don't have to immediately run out of the house in the middle of the night during a storm or during the winter time just because your child has a fever. There are ways to take care of it at home. So what is a fever anyway? So fever is defined as a core body temperature greater than 100.4 degrees Fahrenheit. Fever is a normal biological or natural response to invading germs, and it's beneficial. It's a beneficial defense mechanism. Fever is common in children, and all caregivers will need to manage fever at some point at home with their infant. So before we go on, I just want to throw in a little need-to-know statement. So if you feel your child needs to go to the emergency department, no matter what I say during this presentation, you should always go. You should always trust your gut. This presentation is by no means telling you to avoid the ED or emergency department completely. It's simply giving you a guide as to being more confident in caring for your baby with a fever. The younger your baby is, the more serious fever can potentially become, especially the first month up to the first 3 months. Please take fever very seriously. Contact your pediatrician. So if you have a child that's within 90 days, especially 1 month, 30 days, you should really contact your pediatrician immediately and expect going to the emergency room because it could be a potentially serious condition just due to the fact that your child is so young. So how do I check my infant's temperature? Rectal temperature is the gold standard, is the most preferred method, but prior to doing this, you should ask your pediatrician if rectal temperature is appropriate for your child. Certain medical conditions could make it harmful to do a rectal temperature. For example, a low white blood cell count. If your child is susceptible to infection from a low white blood cell count, it could be dangerous. And also, if your child has a bleeding tendency or problems with thin blood, it could also be dangerous. So just make sure you get the permission. Generally it's safe, but just make sure you get your pediatrician's permission prior to doing rectal temperatures. Rectal temperature measures what's called a core temperature. Basically, you take your child on its back, you take a rectal temperature. I have one here. This is one I use at home for my son, and you can get them at CVS or anything like that. And yeah, you just put it in the rectum, hold their legs, wait for the reading. The next best option is the axillary temperature. Axillary is under the armpit. With that, you can take an oral temperature, just a regular thermometer, and put that in the armpit. Put it in the armpit, hold down the arm, and then hold the arm down, and wait for the reading to come up. There's also ear temperatures or tympanic, and the least recommended is the forehead or the temporal artery. In this picture here, I have a little guy getting a temporal check, but really it's not recommended for infants. And I don't mention oral temperature because generally it's pretty difficult to almost impossible to get an oral temp on an infant, and generally it's pretty inaccurate because they can't hold it in their mouth. So now I'd like to discuss the fever-reducing medications. Generally, there are two. First one I'll discuss is ibuprofen. Ibuprofen is a non-steroidal anti-inflammatory, or an NSAID. It reduces pain, fever, and inflammation. The important thing with that ibuprofen is that it must be given to a child less than over 6 months. So you have to be at least 6 years of age to get ibuprofen. Ibuprofen can be given with food or milk to prevent nausea or upset stomach. Follow the label on the ibuprofen or the Motrin, and speak with your pediatrician, at a well visit regarding, or even on the phone if you have a fever, in administering it. But generally, the main rule of thumb is please do not give it all until your child's at least 6 months old, and it's only by mouth form. So here is a dosing chart for ibuprofen with the weight and how much to administer. Generally, the dose is 5 to 10 milligrams per kilogram every 6 to 8 hours. With these medications, they use a metric system, so kilogram is 2.2 pounds. So that's why it gets a little confusing when you say kilograms to someone who's not familiar with it. But generally, you give about the maximum dose is 4 doses per day of ibuprofen, and this chart really puts it out nicely. And this will be on the back of the labels as well. Another fever-reducing medication is acetaminophen or Tylenol. This one is very common, very safe too. It can be given pregnant mothers. This is about all they can take. Childs of any age can take this. Reduces pain and fever. Again, with ibuprofen, please follow the label and speak to your pediatrician regarding. It can be given with food to decrease nausea or upset stomach. This is our acetaminophen right here. Make sure you shake it up good before you give it. It can be drawn up with a syringe as well, right here. And it can be given by mouth or actually rectally as well. If you're going to be giving it by mouth, even with ibuprofen as well, you take the syringe and you cup the cheeks like this, and you stick on the inside of the cheeks. You don't want to spray directly in the middle. You want to put it right in the cheek there. That way it prevents choking. So the max dose of Tylenol for an infant is generally about 5 doses in one day. And the dosage is usually 10 to 15 milligrams per kilogram, again, 2.2 pounds, every 4 to 6 hours. And the rectal Tylenol starts at 120 milligrams, so they have to be at a certain weight to get the suppository, because it does start at a higher dose. And just like the ibuprofen here, I have a chart to basically describing how much to give, how much to put in the syringe for the child, depending on their age or weight. So I'd just like to close by just bringing up two viruses that can affect your baby. One I feel currently is maybe not getting enough news information right now. Perhaps new parents aren't familiar, but basically it's called RSV. Please refer to your pediatrician regarding the details of RSV. This is just to briefly inform you regarding this. And also, I'm bringing this up just especially since we are in the COVID-19 pandemic. In my opinion, RSV is not really getting discussed and traditionally has been dangerous to children. In the U.S., RSV has been a leading cause of hospitalization and lower respiratory infection among infants less than 1 year. So I have a little information on my slide here. It can lead to long-term breathing problems. It is a seasonal illness in the northern areas of the United States, November to April. In the warmer weather, it can have a longer season. You can get it from infected secretions like saliva and sneezing. And hand hygiene, cigarette smoking, and overcrowding is a good way to avoid this. Or better said, perhaps prevent RSV. So I'm simply bringing up COVID in relation to what is present in our news currently. I'm just bringing it up to compare to RSV, which is a known threat to infants, as compared to COVID-19. Additionally, in my experience as an ED nurse, I find this information can be reassuring. This is not meant to downgrade the risk of COVID-19. It's simply just highlighting, in my experience, I've seen little ones have a much harder time with RSV than COVID-19. So please talk to your pediatrician regarding this, and I'm simply giving you information to be ready to discuss with your pediatrician or a nurse practitioner. Coronavirus primarily affects adults, with low numbers of pediatric patients being infected with COVID worldwide. Based on the data as of January 2021, I know it's a little dated now, but pediatric COVID-19 accounts for 0.8% to 2% of cases worldwide. So among children less than 18, 0 to 4 years makes up about 17% of cases. So it's really affecting children not quite as much as RSV is. So basically, to put a bow on it, at the end of the day, make sure you have a good rapport with your pediatrician and nurse practitioner. Remember to take the rectal or an axillary temperature, medicate with Tylenol and or ibuprofen. Trust your gut, and bottom line, have fun and love your baby. Thank you for listening. Have a great day.